Forward. And this group is focused on using virtual reality to help children and adolescents with autism better optimally manage some of their physical therapy and some of their overall skills around physical attributes. And with an update around a recent study that Playing Forward executed with some Nickelodeon characters. Again, very exciting information about how Hollywood is getting into healthcare. And then again, founded by a Hollywood executive producer, Victor Talbot, also a practicing physician and someone who's behind some of the bigger hits out of Hollywood over the last 30 years. And John Attard on the Oscar-winning team for Gladiator. These two co-founders and now the CEO, Brian Bertha, have put together this platform and have some new data on their virtual reality technology and Nickelodeon characters. Brian, can you give us a little bit of an update? First of all, can you give everyone who's listening a little bit of background on yourself and about Playing Forward?
Sure, Stan, great to have you. And just to clarify, I don't know, is Darren on as well, or am I the only one speaking on this?
I think Darren was trying to join. So for the audience, Darren Hocking is a researcher out of Australia, and he was having some connectivity issues. And again, it's obviously on the other side of the clock in Australia, so understandably. But
no problem. No, I know he was.
I think Darren is on. I think Justin just added him to the panel.
Oh, perfect. Then what I'll do is I'll give a little background, and then I'll let Darren give some of the highlights from the data. So the background briefly, as you said, is Playing Forward is a really interesting mixture of people that are very committed to improvement of therapy for children across a number of spaces, really the initial beachhead being in places like autism, where therapy is critical, but often difficult to get people to do it, kids to do it and to stay on it. And then a combination of that commitment and dedication to a gamification. And the founders spent several years developing from the analog world into the digital world capabilities to improve that technology. They've obviously moved to a digital world and have even been looking at virtual reality, although that's more the focus is on the 2D, given the COVID focus right now. And finally, coupling that with fantastic animation. One of the founders is an Oscar-winning animator, films like The Gladiator, and the other founders have deep experience in games and in movies. And then finally, with branded characters. The idea being that just like medical and technical IP can be critical to moving the needle in healthcare, you think of branded characters as entertainment IP, which is a little different as we look at things in healthcare. But we all know that adherence is around 50%, and we all know in the entertainment world that people watch more movies, they spend more time on games when there's recognized characters, like a SpongeBob. So brilliant and interesting combination. So the task ahead of us was, well, can we actually build on the great data that shows that gamification has caused people to play their games? And when I say games, I'm talking about therapeutic games. Look at me in the film, I'm moving my hands. So the therapist is saying to a child maybe with autism who's maybe young, maybe a little recalcitrant, to do this, and they may not want to do it. But if they say, hey, here's a game, you earn points, and they're watching something and the game requires a movement like this, all of a sudden the patient goes from maybe I don't want to do it to I do want to do it, and that I could actually do it. I might want to do it at home, and I might want to keep playing it. And so the problem becomes the parent stopping them from playing it as opposed to trying to get them to play it. So that's the idea. And so the hypothesis was that we could build on gamification and actually include branded characters, and that we would both see an improvement in times played and frequency of play and time on the game, and that we'd be able to measure it in a meaningful way, which would help understand how to use different characters in different settings. So our hypothesis was that we would see that, And we've done a series of tests, and I'd like to hand it over to Darren, because I think he'd do a great job summarizing
That's fantastic, Brian, and thank you for doing that. And again, for the audience listening, to re-emphasize how important this is a test using Nickelodeon characters. This is very unusual to see a major brand like a Disney or Nickelodeon or anyone, the Sony, letting anyone use their characters to develop and design a pediatric intervention using digital health technology, in this case, virtual reality. So this is absolutely groundbreaking, and it's highly unusual, number one, to see that, but then also number two, to have a rigorous scientist like Dr. Hocking actually pursuing an investigational research study on this. And so, Darren, if you could, again, we've only got about 8 minutes left. I know it's not a lot of time, but this is really about just quick hits, if you will. If you could give us a 2-minute overview of your study and some of what your findings were.
Thank you so much, Stan. Thank you for having me. Just to give you a brief overview of the methods, and then I'll go into some of our exciting results. We had a acceptability study where children participated in a trial with using the app with the Nickelodeon characters to build gross motor skills in children. They spent a minimum of 6 days of physical activity over 15 to 30 minutes each session, up to a period of 14 days, so 2 weeks. Sessions range from about 1 to 7 sessions a day, over to up to 3 sessions over the per day over the period of time. We had 46 children. They were randomly allocated into 2 groups. One group was a branded entertainment condition with the Nickelodeon characters. Children in that group had a mean age of 11.9, and we had another group that went into a non-branded condition, which used generic characters playing forward had developed that children had, but essentially the interventions were identical in terms of the movements that children performed during that trial period. We had 2 levels of data. We measured metadata, so things like app usage, retention, and number of sessions, and so forth. And we also had some survey feedback using the user version of the mobile application rating scale, which was looking at usability, motivation, and user experience of the children. So we actually asked children for feedback through their parents. And this was all done in the home during this 2-week period. So just to go quickly on the metadata, what we showed was that looking at the user engagement and retention rates, that children spent 65% more time across all therapy sessions in the branded Nickelodeon condition compared to the branded, non-branded playing forward condition. They also were able to earn points during gameplay. So they were also able to earn 58.2% more points over that period of 2 weeks. And we saw almost double the retention rates during this trial period. So children in the branded condition with the Nickelodeon had much higher retention rates over the movement period, and they were less likely to quit training over that 2-week period. So overall, the message here is the addition of the Nickelodeon branded content had a multiple effect in terms of higher level of engagement and retention. And we know that better adherence in these types of movement therapies leads to better outcomes in children. And this is one of our major issues, as Brian alluded to earlier. We also had seen in the Nickelodeon condition that children rated the app in terms of much more highly by children in terms of the usability and engagement. So 23.6% more motivated to use the app in the branded Nickelodeon condition compared to the non-branded. They were 18.8% more satisfied with the app, and they were also 28.2% more rated the app as suitable for their age group. So children were much more engaged and found the app much more usable than the non-branded condition. Our focus group survey feedback also reflected this with very positive comments from the children around the app being fun to use, that it was easy to use, that exercise helped me to think about and keep a steady, make it fun for them. It was motivating, and that the app suited their age group. So the next steps for us Playing Forward and with this research study is to expand the study. This is a very initial early stage study with a small sample size. We would like to build the study into a larger validation trial with a larger patient group, and also to consider building evidence that can be usable in remote patient monitoring through various healthcare systems. So we are seeking any interest in building this study into a larger trial to be able to measure the multiple effect of this Nickelodeon branded content in movement therapy.
That's fantastic, and again, this is absolutely incredible research. Well done, Darren, and congratulations, Brian. Really on leading this tremendous relationship. And I know certainly Victor Talbot, again, a practicing physician, but also an executive producer out of Hollywood and Broadway, and a number of other amazing things. And an Australian, by the way, so everyone should know, but a New Yorker now, and I guess Santa Monican part-time, they've really led this effort, and we're getting a lot of good hits coming through on the chat board, and really appreciate it. Alicia would like to know, whether clinical trials been done. Alicia, no, clinical trials have not been done, but that's certainly something in the works. And please reach out to Brian, Alicia, via LinkedIn to follow up on that. And then we've also got a chat box comment from somebody around doing something with the Dan Marino Foundation for you all to consider that. And again, I think that seems to be a really good idea, just given how much good work is going on in Miami with the Dan Marino Foundation and really integrating with Magic Leap. Brian, any kind of next steps and thoughts on and calls to help? Again, this is a kind of an open community. This is really an open collaboration session, this symposium each month. What would you like the attendees to hear about and to know about your next steps for Playing Forward?
Well, first of all, it's just great to participate in something like this. And second, I'm seeing some of the comments that are coming on the chat, and we'll respond individually. We really appreciate thoughts from people in the community. One of the things we found is how unique this is, right? We had discussions with some of the brand holders like Nickelodeon, and they're used to doing things with more traditional uses of their brands, merchandise and so forth. How you apply that in healthcare, there's really not a lot of models. There are models for digital now. There's models for gamification now, like Achille, right? But and for video games. But for branded characters and what's the best way to incorporate those into healthcare, it's really pioneering space. And we're very committed to bringing this to the patients, the children, and the parents that really need their kids to do their therapy. And we really welcome anyone's input and ideas, whether it's commercial means, through grants, through organizations. Someone mentioned the Dan Marino Foundation. All these are fantastic tips. So we really welcome your input.
Super. Well, thank you, Brian. And again, Darren, thank you as well, especially at like 12 o'clock at night or whatever it is, 12:45 in the morning, your time. And hopefully you can get back to sleep and get some rest. Wonderful update from Playing Forward. Again, if anyone has any questions, please message me on LinkedIn.